Today, I'm happy to announce that thanks to our partnership with Common Ground Health, Foodlink and the City of Rochester have been selected to receive a $100,000 grant as part of the Healthiest Cities Initiative and Counties Challenge. Rochester was one of only 20 communities nationwide selected to participate in this challenge. So we have every reason to be proud of this announcement. The funds from this grant will be given to Common Ground Health, and they will work closely with both Foodlink and the city, along with our local residents, to establish a food policy council. The purpose of this council will be to improve the overall health of our community by ensuring equal, affordable access to one of the most basic needs of every human being: healthy, high-quality food. When the city developed the Rochester 2034 Comprehensive Plan as a guide for moving our community forward, we identified increased access to healthy food for all residents in all neighborhoods as one of our primary goals. And one of the strategies listed in the plan to help us achieve this goal was to explore the possibility of a food policy council.
Foodlink's belief in both pre- and post-COVID times is that food should be recognized as a human right, which is why we're eager to engage with the community, work with partners, and pave the way for the City of Rochester's first ever Food Policy Council. It is our hope that the Food Policy Council can open up doors to improve access and affordability of healthy foods in underserved neighborhoods, foster food sovereignty and justice at a local level, and lead to a more nourished, more prosperous region.
We know that people living in poverty are just as concerned as wealthy people and want to eat healthy fruits and vegetables, but often face barriers. Whether it's cost or transportation, they told us about many of these. We know that children, in order to be healthy, need to grow up in an environment where eating fruits and vegetables and other healthy foods is easier than eating junk foods. And unfortunately, that's not the case for many children today. We look forward to working with our community partners, with residents, to identify changes and solutions that are already growing in our community, and to support those with policies and systems that will ensure that every child has a chance to eat a healthy meal.
I'm a resident in the Northeast Quadrant. I also work for road development in the El Camino area. Since the beginning of the pandemic, my primary responsibility has been delivering food to the children, families, and seniors that Ibero serves with the help of Foodlink. Delivering food to so many people throughout Rochester has made me realize the need for food security in our city at a greater scale. I hope to bring other resident voices from my community as we begin to plan and structure this council for a better quality of life for all.
We are going to have a number of residents join Common Ground Health, the City of Rochester, and Foodlink to develop the structure for what a food policy council will look like. But the very first step is to figure out what is the interest in this community. So we are hosting 3 Zoom meetings: August 20th, August 26th, and August 27th, all of them at 5:30 to 6:30. It's about what a food policy council has done. It's going to highlight successes in cities like Baltimore and Cleveland and Toronto, cities that have a lot of similarities to us in terms of where we stand. It's going to talk about next steps and generate interest. And I encourage everyone listening now and all the media who's here today to make sure that they're posting it, helping folks know how to access it, so that when all is said and done, when September hits and the harvest season in Rochester is in full swing, we have hundreds, hopefully, of people in Rochester who are interested in taking this the next step forward and helping Common Ground, Foodlink, and the City of Rochester execute the ROC 2034 vision.